welcome to our session today. My name is Alex. I work on the marketing team here at PerfectServe. I just wanted to say thank you for joining our session with Carly Paul today, one of our implementation specialists. Today, Carly's going to unpack a few examples of how your medical organization can use PerfectServe. And Carly has been with PerfectServe for over 10 years. And Carly and her team have worked with over 5,000 clinics. She's basically seen it all, from the hospital inpatient side to one provider practices to large multi-site, multi-specialty groups.
Thanks, Alex. And thank you guys for joining us today. So with 80% of inbound patient calls being non-urgent calls, like your appointments or routine prescription refills, we want to make sure those calls are handled appropriately and not getting to the provider on call, of course. Otherwise, it can really eat up your doctor's time that they have to meet and treat all of their patients. So this is a main concern we hear over and over again from our medical practices. So today we're going to go over why implementing your medical answering service the right way in the first place is much better and easier for clinicians instead of trying to fix things when it's too little, too late. That way, once your call flow is built and structured appropriately the way you want it to, all of your doctors, nurses, admins, everybody is set up for success. So we'll cover a few examples of call flows today, some best practice use cases for some specific specialties, and it might get your wheels turning a bit on how it could apply to your practice as well.
Thanks, Carly. I'm going to go ahead and turn it over to Joe. He's also joining us today along with Kevin. They'll be able to help answer some of your questions in the chat as well. And he's going to talk about how PerfectServe is more than a medical answering service.
So to give you a bit of background on who we are today, PerfectServe's been around for 25 years. And, we've really evolved from just your, traditional standard after hours answering service to an entire unified communication platform. Bringing your attention, down to the bottom of the screen, you'll see a little bit on the PerfectServe footprint across the country. But just wanted to highlight, we work with over, 100 health systems and 30,000 physician practices across the country, which is, actually about 1 in 6, active physicians. Now, bringing your attention to the middle here, these are our 5 main offerings. So starting with clinical collaboration and the operator council. These are more of our enterprise offerings that really streamline, the communication across hospitals, health systems, et cetera. And really the goal is to ensure messages are getting, to the appropriate care team member at the appropriate time every time. Next is provider scheduling. This is utilized by practices with more, complex scheduling rules and preferences. In short, it will auto-generate, the most optimal schedule to ensure a fair, balanced, complete schedule that accommodates some individual preferences as well. Answering service, this is where we'll be spending our time today, so I won't touch on that now. And then lastly is patient engagement tools. These tools provide a more effective way to communicate and engage with patients and their family members. Now, just some typical issues. So some of our findings have come organically when working with our customer base across the country, and that could be customers that are just those smaller 1 to 2 provider practices to the large, 500 provider plus multi-specialty medical groups. I'm not going to run through everything on the screen here, but I did want to touch on, 3 key themes. The first being budget management. So a lot of the time when practices come to us, they're experiencing fluctuating rates. And what I mean by that is, they're being charged on the number of calls, minutes, messages, hospital calls, et cetera. And the difference between that and what PerfectServe does is PerfectServe offers a flat monthly rate that will not fluctuate month to month. The second piece here is risk management. So practices are coming to PerfectServe looking for, a HIPAA compliant platform, as well as a platform that, has reporting and tracking capabilities when it comes to calls that are coming through, response times, et cetera. And then lastly, and what we hear the most is just that the quality of your, traditional type answering service continues to decline. That could be for a number of different reasons, but we see, staffing shortages, lack of employee retention, but most importantly, really just the amount of opportunity that there is for human error throughout that process, which of course leads to, delayed, missed messages, non-urgent messages slipping through the cracks, waking the providers up in the middle of the night, delays in urgent calls getting to the appropriate on-call provider or going to the wrong provider, et cetera. when you think of the PerfectServe answering service, there are really, two goals. One, speed up time to treatment, for those urgent calls. But two, avoid any of those unnecessary interruptions that shouldn't be bothering, the providers, whether it's during the day or after hours. So when you look at speeding time to treatment, how do we do that? One is we're going to ensure that, your messages are accurate and they're being delivered in a timely manner. Carly's going to get into how we do that in a little bit. From there, when the messages do get to the appropriate provider, we have escalation processes we can put in place to ensure that those messages are checked in a timely fashion. And then lastly here, we wanted to make sure that we had an easy way for providers to get back in touch with patients. And the way we do that is with every urgent message that comes through, the provider is also going to get that caller's confirmed callback number. All they need to do to call that patient or caller back is tap right on that number and it'll call out, immediately. Now, on the other side of things, no unnecessary interruptions. A few things we do to help with that here are one, when a provider does call a patient or caller back, it's going to protect their personal caller ID. The caller is going to see their main office phone number, not a blocked number or not that physician's personal cell phone number. Two is secure texting. So with the answering service, it also allows for secure texting for the internal care team. And that's all HIPAA compliant. So it'll allow for messaging throughout the day and at night, just ensuring efficient communication. And then lastly is on-call schedule management. So PerfectServe's cloud-based. So any updates that, are made to the on-call schedule go into effect immediately in real time, ensuring that, there's no confusion around who's on call and where messages need to be sent.
Looks like we do have a couple questions in the chat so far. One of the questions was filtering unnecessary calls. And it looks like another question is looking to customize how messages are delivered based on my clinical schedule and home call.
Yeah, well, I've got a screen in a little bit that talks through our call flow and how we can design all of that to make sure that any unnecessary calls are accommodated in the workflow and we're routing those appropriately, not to the on-call provider. One way we can do that is what sets PerfectServe apart from our other communication platforms is dynamic intelligent routing. So this will ensure all incoming calls and messages get to the correct person or office staff. So we can filter on things like who's calling, what they're calling about, the priority of the message, and make sure that message is handled appropriately. So let's break it down here. So we understand that like a routine consult needs to be routed completely different than an urgent patient message. So we consider each of these variables for every single call. You can see all these on the screen here. Of course, the date and time of the call as well. So when a caller interacts with your customized routing, the system will create that unique path to get to the message to the right person at the right time. And this is all programmed behind the scenes to make sure the appropriate routing happens every single time. So when our team works with you, we're going to set up a call flow just like this. It is fully customizable. We can determine the information, level of detail, any routing methods that you want in place. This is kind of as simple as it gets, but we can be as complex as we need to be. So what does it take to go live with us? Here's what you can kind of expect here. So first we'll start out with our consultation. So we'll talk about some housekeeping items, your hours of operation, holiday time off, but the bulk of the call will be building your workflow design. We'll take you step by step to determine all of the prompting and routing and any protocols you have with your workflow. And we'll also talk about any pain points or goals that you have for your office answering service. And then we'll get all your providers and administrators set up. We'll give everyone credentials, make sure they get onboarded with the PerfectServe mobile app, or if they need web access, all of that, and answer any questions you guys have. And then once everything is in place and ready to go, we will go live. So this means that you'll forward your line over to your new PerfectServe line and your newly designed workflow and features. So there are many best practices that we've designed over the years, but I'll share a few examples of how we've worked with a few different specialties and some use cases that may apply to you guys. So family medicine, pediatrics, OB, those are all good examples of high volume calls from patients or parents or their caregivers, and they're calling at all hours, right? So our workflow rules that we'll design with you will make sure we direct those callers to the appropriate path for what they're calling about. So if that's leaving a message for the office to address the next business day, or actually getting in contact with that on-call provider that night, if you work with a triage service as well. When I was pregnant with my first child, they told me at my appointments what to do when you think you're in labor. I think they gave me a piece of paper telling me exactly what to do for all different scenarios. And one of the instructions was, if your water breaks, just go to L&D. Easy, simple. But when my water broke, my brain fell out of my head and I didn't remember a single thing that they told me, let alone where that piece of paper was. So what did I do? I called their office. I left a message for the on-call provider. I waited probably about 45 minutes. Finally got a call back telling me to just go to labor and delivery. I'm sure that provider was slightly annoyed with me that I didn't listen to any of the previous instruction that I had been given before. And I wasted 45 minutes of my time as well. And I ended up going to L&D, of course, and having my baby. But now many of our clients for OBGYN groups or just OB groups will choose to put specific labor instructions into their prompting. So the patient, here's what to do before leaving that message like I did. So problem solved.
Someone's wondering, how do we avoid patients that select the call as urgent when it's actually non-urgent, such as an appointment or a prescription refill? What are some of the steps we can take there to help avoid that?
So first of all, ordering the menu in a way that caters to your patient population. So what I mean by that is if you get a lot of routine calls, let's put that option first. But we'll also put some screens in place just to make sure that those callers know that leaving a message for the on-call provider is only something they should do in certain scenarios. So again, including specific prompting if we have that, like when they should leave a message, but also just warning them that the physician on call is only available for those urgent calls after hours, and they cannot schedule appointments or call in any routine prescription refills, things like that. We'll also give them an opt-out after hearing those prompts. If they're like, oh, just kidding, it's not actually that urgent. And then they can leave a message for the on-call provider, or sorry, for the office administrative staff to check the next morning. We also have some offices, say that if their call is deemed not urgent by the on-call provider, they may be charged a consultation fee. So depending on what your needs are there, we can work with you on the prompting for that. All right. We work with a lot of nephrology clinics because of our ability to accommodate for the hundreds of dialysis that some of them go to, dialysis centers or nursing homes that they cover. So our system can match the facility that the caller says that they're calling from with the appropriate call schedule coverage to get to the right person. So whether that's a group of dialysis centers in a certain region all go to one call schedule, or maybe each dialysis center has their own unique call schedule. So we can accommodate for that by hearing where the caller is calling from. We can also take a routine message at night from a nurse. So it's 3 a.m. It's a routine message that can be handled in the morning. We can hold that message, take the message from the nurse when she calls, he or she, and hold it overnight so we don't wake up that provider in the middle of the night with a routine matter. And then the system can deliver it to the provider who's actually coming on call the next morning, who's going to be rounding up that facility the next morning. So both of those scenarios are applicable for other specialties too. We do a lot of similar things with like hospitalist groups too. So timely patient discharge is a very important data point to a lot of our hospital systems. At UTMC, UT Medical Center, their cath lab, they were struggling to schedule follow-up appointments after a patient has had a procedure, which is a requirement prior to discharging that patient. So the nurses were spending time playing phone tag with the office, and patients were upset because they didn't know the process and they really just wanted to go home. So the nurses needed a way to easily get in touch with the office to get that appointment on the books so that they could then discharge that patient. So we are able to help them by organizing direct contact with the scheduler that was in the office at the time to seamlessly communicate back and forth the patient's available times to come in for appointments and the office's available appointment times. So that was a really cool thing we did for cardiology group and a few others too. Could be applicable for other specialties, other surgical specialties as well.
one question we got, I don't know if you addressed this yet or not, Carly, is on the multiple physicians on a weekend. I think you addressed that.
So if you have multiple physicians on call on a weekend, we would need to know if that's multiple physicians, different timeframes, if you just have different timeframes, or if there's multiple physicians for multiple either locations that you're rounding at, or maybe it's somebody takes call for consults and someone's taking call for new admissions. Those are things that we would talk through with you during your consultation, and either put that into our prompting to say, you know, for new admissions, press whatever, and for established patients, press 2. Or if it's different physicians during different times on your call schedule, that's how we would build out your call schedule recurring there.
Another one would be, I saw this one come in earlier this morning about live operators. Can you speak to that a little bit as well?
With a live operator system, we can, what we do offer is our agent text transcription service. So that is a live person. They do not route the call. All of the routing is determined by our workflow that we design. So it's the same thing that happens every single time. And there's no human error on that piece. But our agents at PerfectServe can get you a text message rather than a voicemail. So you can speak to our agent at PerfectServe, your callers can, and they can type out that message. So your providers don't have to listen to a voicemail. They can instead get a text message.
Cool. And I think you also mentioned something earlier too about like providers getting woken up in the middle of the night. You know, why would that happen? I guess if someone's like, hey, I got dinged in the middle of the night and I'm not supposed to get this non-urgent call. What's happening? You know, I hear that a lot for practices too.
Yeah, so we'll ask the caller if this is a routine call that can be handled in the morning, and we can do one of two things with that. We can either just take that message and save it for whoever was on call at that time, but not notify them of that message until the morning. Or we can take that message and hold it on our system and deliver it to whoever's coming on call the next morning, maybe the rounder who would actually round on that routine consult the next morning. So depending on your workflow with your office, we can talk through which option would be best for you.
So it sounds like for practices that are like, well, I want to set up a workflow, it's pretty much customizable, right? They can do
It sure is.
one.
Yep. We'll walk you through it.
Okay, cool. It looks like we have another question that just came up. Do your agents know multiple languages? What languages do they speak besides?
Great question. So if you do choose to want a text message rather than that voicemail, our text agents can speak Spanish as well. So they will talk to the patient in Spanish if they need to. And they'll type out that message in English, but at the bottom, they'll just say that this message was transcribed from Spanish, just so that you're aware as the on-call provider that the call was originally in Spanish.
Well, thanks. I mean, we're getting some good questions. We have another one here in the chat. Is there ever a point where callers would speak directly to a live operator?
If you do choose to add the voice to text service, they would speak to our live agents. Again, the routing and all the determining of the workflow would happen prior to getting to our agents. So our dynamic intelligent routing and the callers interaction with that would determine the routing. Our operators are there just to get a text message instead of a voicemail.
Right. They're not medically trained, right? They're not like
That's
people
correct.
to triage. But they can take critical patient information, get it in a text form. So let's say you are on call as a physician at night, you get this message. It's not a jarring, angry voicemail yelling at you. It's a text you can securely read and be like, oh, I'm going to call this patient back because it looks critical or something like that. Is that about right?
Correct. And then we eliminate the need to, transfer a patient directly to the provider, right? If don't call me, text me, please. Right. No, not a lot of people like the live call anymore. They want to read the text to get their thoughts together, maybe look up the patient in their chart or something like that, and then make that call back. So that's where the text is really nice.
Yeah, and it's probably they don't have to click like everywhere, like in an EHR system where you got to click like 100 different places. Here, you're just like, okay, I see the patient message, I can get back to them. Is it that easy?
Correct. And your the callback number for the caller is actually live linked in that same message. And if you call through the app, as Joe mentioned before, it will hide your personal cell phone caller ID and display your office main line.
Oh, so they can mask that main line, so it's not showing up as their personal private phone. It's showing up as the office.
That's correct. Yeah. If the patient tries to hit redial on they won't get your cell phone. They'll be directed back to the office.
Okay. Wow, you guys are active today. Thanks for asking questions. We have even more. You ready, Carly? We have some more questions here.
Sure.
The next one is, we are a pediatric cardiology office, and there are times when the hospitalist needs to speak directly to the MD on call. Are you able to patch through phone calls?
Yeah, absolutely. If you do want a phone call, yes, absolutely. So that would be something that we would design specifically for that workflow. I'm sure you don't want a live phone call from your urgent patients. Maybe you do, but I'm guessing those are probably the only live phone calls you want. So we can specifically only for those types of calls, the system will know that is a phone call that needs to be patched through to the on-call provider immediately.
Great. And then I'm going to keep going here. We got another one. Do you create diagnosis-based clinical workflows or post-operative workflows?
Yes. So it depends on what you're kind of looking there, what I would suggest, but yes, we do work with colorectal groups that pre-op surgery instructions, things like that. That's a part of our patient and family communication offering that Joe had mentioned before. So I definitely like to talk to you a little bit more about what you're trying to accomplish there, maybe post-op follow-up, automated messages, things like that. We do have an offering for that.
Also, is the live operator service part of the flat rate you mentioned earlier?
Yeah, and I can take that, Alex. Yes, it is. So it's an additional fee, but it still is a flat monthly fee. So you're not going to, pay for the number of calls or minutes or messages that come through. It's just a flat fee.
And then are the operators in-house at PerfectServe?
They are not. We could get into the specifics, at a later date, but that's something that we can discuss.
On the live agents question, they're not medically trained. However, do they have the ability to hold any calls when it is something that is clearly non-clinically related, such as the caller calling to confirm their appointment?
Yeah, good question. So the operators don't see your workflow or anything like that. All they see is the form that you choose for them to fill out. So for patients, obviously, we're not going to ask your department and unit number and room number. But for nurses, we are. So different interactions would have different forms of questions that they're answering. So they can see the form, they can see who the call is going to, but they have no reference to the prior workflow that happened. All of the routing and determinations is based on the caller's interaction with that dynamic intelligent routing there. So that is all determined before they get to our agents. If something is routine that our agents are typing out, they have no inkling of that it actually shouldn't go to Dr. Carly Paul, and they just simply get it into text form. So that's why it's so important to during your implementation period make sure that we're accounting for all of the different scenarios that you guys experience. Maybe that's a pain point for you, and we need to bulk up some of our routing and prompting on that.
Well, and so you guys, the implementation team, works with the customer to really map all that out, basically.
Correct. Yes.
You can set this up ahead of time to save you guys hours and hours later. If you get this done and implemented right, it'll save you headaches, it sounds like, if you're a practice manager or a doctor.
Another question I saw, I want to make sure we address. It looks like it got answered in the chat, but there's questions around if you can have a call directly patched through live to the on-call provider, and yes, you can. That's an option as well. So all of the contact methods are fully customizable. So if you want a live call patch directly through, you can. If you want a phone call, you can. If you want a text notifying you that you have an urgent message, that's also an option. We can even work with pagers or call a home phone number. And the reason I wanted to make sure we address that is because when, we say PerfectServe is customizable, we can get that granular, and we could have it set up by physician. So if one provider wants it one way and one wants it another, those are all options that are out there.
As we kind of talked about before, we work with all different practices, various sizes and specialties, independent on your size, your specialty, complexity of your workflow. Everything can typically be set up as quickly as 2 to 3 weeks for one single office. So we'll walk through with you to ensure all your clinicians and care team members are all set up for success. And then after your go live, we do have our 24/7 support team that's available to help with any ongoing needs. So at the bottom there, you can kind of see the whole process of the implementation.
One thing to emphasize there, Carly, as well, with the 24/7 support, just because I know there are other vendors out there, you do need to pay anytime you want to make adjustments. Our support center is included in your monthly fees. So if you need to make adjustments on your account at any time, reach out and it's free of charge.
If you'd like to take the next step and meet with Joe or any of our team, you can get in touch with one of our experts. And when you do, setup is pretty easy. You can basically sign the order form when you've decided to move forward with us. And then Carly and her team are going to go ahead and build all those flows out that they just talked about. They're going to help you with that. And then you can begin that 30-day risk-free trial by emailing Joe here at PerfectServe.com, Joe Fosso at PerfectServe.com, and he can get you set up with a specialist who can actually show you even more in depth, like what the product looks like, some of the desktop app, the mobile app, and they'll talk you through some of those key points that you might need for your custom workflows. And they can also talk custom pricing for your unique practice and your practice's needs, because we do offer different packages, and that's what we have. So do callers always start with an automated system, or can they get a live operator first?
Good question. If what you're trying to accomplish there is try to make sure that the routing gets the right place, I'd like to just talk a little more about what pain points you're having right now. We can accomplish most every scenario with our automated system first. The live operator again is just to send a text, so they would not be able to do any routing if we did that route. So the answer is no. We would need some sort of routing before it gets to our text agents there.
All right. Well, thanks everyone for your time. I think that's the last of our questions. Our time is up, and we'll hope to see you guys in some future videos. And again, thank you, Carly. Thank you, Joe. Thank you, Romu.
Thanks, everyone.
Thanks.